Yoga, a transformational modality. Helping AHEC scholars form a professional opinion on yoga to share with clients. Hi, and welcome to this lecture on the evidence base for yoga's clinical utility and health benefits. My name is Dr. Samuel Gentili, and I am a licensed occupational therapist. I am thrilled to be delivering evidence-based yoga curriculum at the healthcare graduate student level. This lecture is entitled Yoga, a Transformational Modality, helping healthcare students form a professional opinion on yoga to share with clients. I am really passionate about this project because I am aware that not all of you will adopt a personal yoga practice. However, I am sure that all of you at one point in your career will be asked a question by a client about yoga and believe now is a great time for you to form a professional opinion about it. The sections of this presentation are explaining why this knowledge is important for future healthcare professionals, the limitations of yoga research, and then yoga's evidence base for psychological, physical, and skeletal conditions, respectively. Then we will discuss contraindications and limitations in yoga research and future directions. The pose being featured here is arm balance preparation. Here is my contact information. Should you have any questions, comments, feedback, or know of any curriculum development opportunities, please send it all my way. There are 4 videos in this module. Here are the thumbnails for the YouTube videos. There are 2 short yoga sequences, one that is designed for stress relief for healthcare workers and students, and one that is clinical chair yoga that one can do with a patient. There is one lecture on evidence-based yoga and its clinical utility as a modality, which is this one, and there's one on yoga as a self-care intervention for healthcare students and workers. This presentation was made possible with support from the Oregon Healthcare Workforce Institute Area Health Education Center at Pacific University. This course is the result of a collaborative effort with the Oregon Healthcare Workforce Institute Area Health Education Center at Pacific University. I'm not going to read all of these learning objectives out loud, but you are more than welcome to pause and read through these. I do not want this module to feel like busy work or like I am a broken record saying you must do yoga. I know not everyone will become a yogi from this module. What I want, though, is for everyone to have a basic understanding of what yoga is, whether to use it for their own self-care or to recommend it to clients and colleagues who could benefit from it. The content of this lesson is the result of a research question that I had for my doctoral capstone experience that was asking what information from evidence-based literature can be used to best prepare students of health professions' self-efficacy to recommend and use yoga as a self-care intervention. The pose being featured is side lunge with prayer hands. The overarching learning objective for this presentation is that participants will be able to formulate a professional opinion on the benefits of yoga on the mind and body as a holistic treatment for physical and behavioral health issues. The pose being featured here is wind relieving pose. In a survey study that was actually conducted at Pacific University, my alma mater, Sulenz et al. 2015 stratified each health professions program offered at Pacific to see which type of student would be more likely to recommend yoga to clients. They found occupational therapy students were most likely to recommend yoga, followed by physician assistant, psychology, physical therapy, pharmacy, dental hygiene, speech pathology, audiology, and then optometry students were least likely to recommend yoga to clients. In the same survey study, the researchers found that the students were most likely to recommend yoga for musculoskeletal conditions, such as issues with balance, posture, range of motion, and musculoskeletal pain, followed by psychological conditions such as anxiety, anger, depression, post-traumatic stress disorder, and low self-esteem, followed by physical conditions such as cancer, fatigue, insomnia, and arthritis. I stratified my content to try to address all three categories of symptoms and separated the content in this presentation on these three symptom categories: musculoskeletal, psychological, and physical conditions. Why clinicians need to know more about yoga? Healthcare professionals have a professional obligation to answer clients' questions about their health. Yoga is not going anywhere, and all of you will be treating clients who practice or have tried yoga. In fact, yoga is the most common complementary alternative medicine modality practiced within the United States today. This includes acupuncture and massage therapy. 36 million Americans regularly practiced yoga, and in 2016, in a Yoga in America study, 80 million Americans reported that they are likely to try out yoga in the future. The yoga pose featured here is Baddha Konasana, otherwise known as bound angle pose. Depending on one's healthcare profession, they will be asked certain questions about yoga by clients. Certain professions like optometry or dental hygiene may receive fewer questions about yoga than occupational and physical therapy. However, clients will ask them if they can do certain yoga postures after a dental procedure, or how they can still practice yoga while dealing with a low vision or macular degeneration diagnosis. Clients may ask if they can still do yoga or ask for an alternative to medication for certain conditions like stress. They may ask if they should do yoga, if yoga is safe, or if it could help them with anxiety. However, as a client, at student dental hygiene clinics and student optometry clinics, I know that they ask detailed information, and yoga can be included in patient screening across all healthcare professions. Also, dental hygiene students and hygienists alike may benefit the most from yoga since they are frankly bent over people's mouths all day, which affects their posture. Yoga is much more than just holding poses. It is important to mention to clients that yoga is not just movement. Many people believe that yoga is just stretching. It is much more than that. Three major components of yoga to discuss with clients include movement, both holding poses, which is static, and moving joints through their entire range of motion, which is kinetic, breathing exercises, and meditation. In the other lecture, I go into more detail and discuss the 8 limbs of yoga. When you're talking to patients, you don't need to go into all that detail with the client, but it is worth it to say yoga is more than just holding poses for flexibility movement, but also includes breathing exercises and meditation. The poses being featured here are frog pose and bound angle pose. I was amazed at all the evidence for yoga's benefit for mental health. Research studies suggest that yoga increases GABA and testosterone levels and decreases cortisol, our stress hormone. This increases feelings of calm, which decreases anxiety and depression symptoms. GABA is an inhibitory neurotransmitter, which pretty much tells the brain and body, you can stop it with the fight or flight response. We're all good here. Time to relax. You better chill out. GABA will attach to a GABA receptor protein within the brain, which will increase a feeling of calm and contentedness, which can combat or serve as a buffer against anxiety and depression. The pose being featured here is locust pose. There was a fascinating 2004 pre-test post-test study done in Russia where they essentially measured blood serum levels of testosterone and cortisol in 11 subjects. They took the measures before and after holding Bhujangasana or cobra pose for 5 minutes. This is an exciting study because it shows that yoga can change our bodies on the hormonal level. I think this is so cool that doing 5 minutes of a single yoga pose can change your blood chemistry according to this study. They found that on average, there was an 11% increase in testosterone levels and a 16% decrease in cortisol levels. As many of you know, cortisol is a hormone associated with stress. There is an amazing documentary on YouTube called Why We Breathe, which is one of my favorite yoga documentaries. There's a quote that one of the yoga instructors interviewed shared that I want to share with you guys. What attracts people to yoga is often the physical benefits, but what keeps them coming back, what gets them hooked, is the mental, emotional benefits. I often say in my yoga classes, yoga is not about how it looks on the outside, but how it feels on the inside. I said this in both the video routines I made in this module. Yoga is very transformational. It can really transform somebody's health status in many different ways. Practicing yoga at a yoga studio at least gets one out of the house and into the community. From experiencing teaching both yoga and Tai Chi, I believe that there is something about synchronous movement that bonds humans and helps people connect with others. Yoga is good for introverts because they can be around people without needing to have a conversation. Doing a structured activity with other people is very healthy, especially in people who are going through isolation. I am in a position right now as a licensed occupational therapist, curriculum developer, and guest lecturer, where it is safe for me to self-disclose actually that this concept is very personal to me. I have been hospitalized for psychiatric reasons in the past, and I feel as though my yoga practice has helped me heal a lot of things and gain control over my mental health symptoms. Yoga can help someone with debilitative mental illness reach a state of well-managed mental illness. Brinsley et al. Completed a systematic review of 19 studies to determine yoga's clinical utility in patients with different DSM diagnoses who had depressive symptoms. The yoga intervention in the studies had to be at least 50% asana movement based in nature. These diagnoses included depression, PTSD, schizophrenia, anxiety, alcohol dependence, and bipolar disorder. Across studies, the yoga intervention group had significantly lower depressive symptoms than the waitlist control group. A relationship between the amount of yoga and the reduction of depression symptoms was common. This implies that yoga and depression, there is a dose-response relationship. Multiple studies suggest that the more yoga one does, the more efficacious it is for their health. One perhaps has to practice yoga at least once a week to sustain higher amounts of GABA neurotransmitter, which reduces depression. A large barrier for many is the time it takes to do yoga. Traditionally, yogis say that this makes one's time management better because they learn to make time for themselves. The pose being featured here is tripod headstand. Yoga and body image. Using assessments which measure body image, Aleva et al. 2020 found that women in the Hatha yoga group had statistically significant lower scores on the self-objectification beliefs and behavior scales and improved scores on the Physical Body Experiences questionnaire. This implies that students tended to feel more comfortable in their body, view their body as a positive, powerful being, and feel confident in how their body moves throughout the world. I taught yoga in an eating disorders clinic for 2 years in Massachusetts. My youngest client was 9 years old and had anorexia nervosa, in part due to ballet training. I asked my clients to picture their favorite place on earth as part of the closing meditation, and after the class, I asked them what they visualized. This client said her favorite place on earth was Disneyland, and my heart broke that someone so young and innocent was struggling with body image so severely. The fact that we have research that suggests yoga is good for body image means a lot to me because of my experience there. There was a study done in 2018 which showed that yoga, when compared to reading materials, was much more effective at reducing cigarette cravings in smokers who are looking to quit. It is commonly mentioned in the yoga community that yoga can produce enough good feelings in the body that cravings for junk food, cigarettes, and alcohol reduce significantly. When I taught yoga in a dual diagnosis detox center, one of my patients I had taught several classes to said, "I can't wait to get yoga stoned." The yoga buzz, or being yoga stoned, refers to a feeling of euphoria that comes from the practice of breathing, moving, and meditating that for many helps them reduce cravings for substances and junk food. A less scientific and more spiritual way to say it is that yoga may help people who are filling a void in their psyche with a substance fill up that that void naturally through yoga instead. They even have 12-step yoga where they do yoga for people recovering from addiction as they go through the 12 steps. Yoga and generalized anxiety disorder. There was a fascinating study where Kundalini Yoga was compared to cognitive behavioral therapy, and a stress education group was used as the control. All participants were diagnosed with generalized anxiety disorder. Assessments used to measure a change were the Clinical Global Impression Scale, the Metacognition Questionnaire, and the 5-Facet Mindfulness Questionnaire. The findings were really interesting. CBT, the gold standard for non-pharmacological treatment of anxiety, was more effective at anxiety reduction than Kundalini Yoga. However, Kundalini Yoga was still an effective treatment, as you can see in this figure. Both were more effective than the stress education control group. The implication is that CBT is still the best option for anxiety. However, Kundalini Yoga might be a better option for someone who does not have access to CBT due to insurance issues, costs, or scheduling. Anyone can sign up for a yoga class at a yoga studio or a synchronous online yoga training, but not everyone can find a CBT group that is affordable. A meta-analysis of 17 studies on yoga for anxiety revealed that there was a medium effect size, G equals 0.44, for benefit within the yoga group, and a higher but still medium effect size, G equals 0.61, when the intervention groups were compared to the controls. The higher the anxiety, the more someone had to benefit from the yoga intervention. This meta-analysis is further evidence for the dose-response relationship, as the amount of yoga practice directly influenced its effect at combating anxiety. Yoga and neuroplasticity. In a 34-study critical systematic review on neuroimaging studies for yoga, researchers Van Alst et al. 2020 found that yoga practitioners on MRI, PET, and SPECT scans had more cortical thickness in the left prefrontal area, which has to do with speaking, more activation of prefrontal cortical regions involved in self-control and cognition, functional connectivity modifications in support of the default mode network, which assists in the creation of a rest and relaxation state of mind. And that indeed, consistent with many other studies, there is a dose-response relationship between how much yoga one does and the health benefits that they enjoy. In conclusion, the more yoga, the more positive brain changes. Another key finding in the same neuroimaging study is that yogis have more gray matter volume in their entire brains than the average population. Gray matter is neurological tissue that assists humans to have increased command over sensory motor, cognitive, and emotional functions compared to other species. Regions of the brain with more gray matter in yogis than the general population are the insula, which has to do with pain perception, body awareness, balance, sensory functions like hearing and tasting, the hippocampus, which has to do with learning new things and remembering experiences and information, the ventromedial orbitofrontal cortex, which is making decisions, the medial inferior temporal gyrus, which has to do with recognizing and processing objects visually, and the inferior frontal gyrus, the pars orbitalis, which is Broca's area, which has to do with expressive language and the creation of words. As you can see here, yogis have better brain functioning when it comes to parts of the brain that have to do with vision, which is a direct tie-in to optometry. Implications of the data include that yoga helps humans eventually have more mastery over their own brains, which includes control over one's own emotions. Also, yoga improves neurological functions in cognitive, sensory, and motor regions of the brain, and yoga in general helps with learning and memory. It is important to note a major confounding factor. If you do a lot of yoga, chances are you do other good things for your health and are around people who do good things for the health. Is it yoga itself changing brain function, brain structure and function, or a healthy lifestyle in general? The studies do not compare with neurobiological studies on physical activity in general, an admittedly major research limitation. This is a very exciting slide because it shows evidence of anxiety-reducing neuroplasticity that we can actually see on brain scans. The Rotterdam study is an ongoing longitudinal study measuring disease predictors in elderly adults using neuroimaging. Longitudinal research suggests that stress reduction is related to lower right amygdala volume. The reason I included this in this presentation is that there is a growing body of research that yoga and related movement and meditation disciplines can actually change the shape of one's brain. It is also interesting to see that within the context of larger longitudinal neuroscience research, yoga is being viewed as a potent intervention. 289 participants already enrolled in the longitudinal Rotterdam study who practiced a mindfulness modality for at least an hour a week were compared to participants who did not practice mindfulness. The researchers did a cross-sectional analysis of MRIs with questionnaires about use of meditation, yoga, Tai Chi, and Qigong. The median length of time practicing was 10 years. They found a statistically significant smaller proportion of right amygdalae to total brain volume in mindfulness group rather than the control group. In this clinical trial, Liu et al. 2020 concluded that yoga, when mixed with information support methods, led to improvements in anxiety, depression, and sleep quality in menopausal women. Yoga's effect on anxiety, depression, and sleep quality is fairly well documented, and these three conditions commonly affect graduate students. If you have a client going through menopause, you can suggest yoga to help them with anxiety, depression, and sleep, and say that it is evidence-based. Yoga and the autonomic nervous system. The autonomic nervous system is the part of the nervous system that is not conscious and helps the body naturally self-regulate. In a 59 study systematic review, Siagi and Cohen, 2016, found that yoga showed significant improvements in heart rate variability, vagal tone, and vagal dominance. Heart rate variability is the change in time between heartbeats and is an important predictor for future cardiovascular disease. It is regulated by the autonomic nervous system. Vagal tone relates to vagus nerve activity, which helps the body and brain react to stressors. Experienced yogis were shown to have better vagal tone. Vagal dominance refers to the human organism's parasympathetic nervous system being activated more than their sympathetic nervous system. Yoga and depression. In this randomized controlled trial, LaRocque et al. 2020 found a statistically significant reduction in both perceived stress and rumination in women with unipolar depression when they practiced 90 minutes of Bikram yoga a day for 60 days. Bikram yoga is a set sequence of 26 postures and 2 breathing exercises that focuses a lot on back bends, which is what a lot of Americans need in order to combat forward-leaning posture. It's also done in 105 degrees Fahrenheit with 40% humidity to mimic the climate of India. A lot of the benefit is definitely the yoga, but some of the benefit is heat therapy since it's almost like doing yoga inside of a sauna. Some of the next section of this presentation is musculoskeletal conditions. Some of the benefits of yoga include increased range of motion and flexibility, gait, postural control, and balance. Decreases have been found in risk for herniated disc, carpal tunnel syndrome, and musculoskeletal pain in general. It's important to emphasize that yoga is transformative. It has the potential to help someone transition from a state of debilitating chronic pain to being able to manage their pain in a healthy, natural manner. Gentle range of motion exercises such as wrist circles can help lubricate the joints. A lot of humans these days don't often lift their hands above their heads, which over time limits the range of motion of their shoulders. Yoga requires that people move their joints through their range of motion. In this 2021 randomized controlled trial, Mirzai et al. 2021 measured musculoskeletal pain in elderly females who were 60 plus years of age and had musculoskeletal pain. The yoga group had 3 one-hour yoga training sessions a week for 8 weeks. After 4 weeks, overall musculoskeletal pain on the McGill Pain Questionnaire decreased for 8 weeks. And after 8 weeks, there was a statistically significant decrease in the submeasures of sensory dimension and pain severity. This is also evidence of the dose-response relationship, meaning the more yoga one does, the better the health benefits. What is interesting about this study is there was noticeable benefit to the musculoskeletal pain first, and then more nuanced and specific measures of sensory dimension and pain severity decreased as the participants did more yoga. A 2022 systematic review of 18 studies on yoga for fall prevention concluded that yoga improves physical functional capacity of older adults with a variety of well-respected interdisciplinary measures of physical functioning, including the Berg Balance Scale, the Short Physical Performance Battery, the Sit-to-Stand Test, the Back Scratch Test, Mobility and Gait Speed, and the Timed Up and Go Test. Fall prevention needs to be a priority for many vulnerable populations, such as people who are elderly and people going through addiction withdrawals. This systematic review shows robust evidence that yoga is good at preventing falls since it improves balance, mobility, gait, and postural control. The systematic review also showed mental health benefits and higher quality of life and better emotional well-being using the World Health Organization Quality of Life Questionnaire and the Better Emotional Well-Being WHO-5 Well-Being Index, which included mental well-being, visual working, and verbal memory, reduced anxiety, and reduced fear of falling. Also, yoga improved focus, sleep quality, and executive and psychomotor function. In a pre-test, post-test quasi-experimental study, Kelly et al. 2014 found that when 13 older adults were taken through 24 60-minute Kripalu yoga classes over 12 weeks, they had improved postural control, improved normal and fast gait speed, and improved balance using well-accepted measures such as the Mini Balance Evaluation Systems test, normal gait speed, fast gait speed, and the timed up and go test and timed up and go dual task. All of these measures showed statistically significant improvement, and the pose being featured here is Warrior 2. The modality of yoga is just transformative. Yoga could be a safe and effective activity to help a patient transition from a sedentary lifestyle to a more active one. According to a 2016 Yoga in America study, 79% of people who practice yoga reported engaging in other forms of exercise, such as resistance training, running, cycling, hiking, etc. When older adults have a sedentary lifestyle, yoga provides them with a daily activity and excellent hobby. Yoga and carpal tunnel syndrome. There was a high-quality randomized controlled trial that has informed the National Institute of Health to recommend yoga as carpal tunnel syndrome prevention and treatment. It was a blinded trial with a detailed, well-explained yoga intervention protocol. The researchers found that patients with carpal tunnel syndrome doing 60 to 90 minutes of yoga twice a week for 8 weeks had significant improvement in grip strength, pain reduction, and Phelan sign, which is a provocative test for carpal tunnel syndrome. A blinded medical doctor evaluated the patients without knowing who did the yoga and who was in the control group in order to prevent researcher bias. No statistical improvement in Tinel sign, sleep disturbance, or median nerve motor and sensory conduction time were found in the study. In a case control study, Zhang et al. 2011 compared MRI scans of the spinal columns of experienced Hatha yoga instructors compared with people of good health who did not practice yoga. They found significantly lower cervical degenerative disc disease and overall degenerative disc disease. They also had lower scores at 3 vertebral disc levels, C3, C4, L2, L3, and L3, L4. This makes intuitive sense, as in general, yoga practice should begin with 6 intentional spinal movements: flexion, extension, lateral bending to both sides, and spinal twists. It's important to note that being a Hatha yoga instructor for 10 years is a very large dose of yoga. Yoga and Parkinson's disease. In a randomized controlled trial on yoga for people with Parkinson's disease, the intervention group received 2 45-minute yoga sessions a week for 10 weeks. They had significantly improved balance ability, gait pattern, and joint kinesthesia flexion. I witnessed LSVT therapy in one of my fieldwork rotations and felt like many of the movements had been adapted from yoga, so this is not surprising to me that yoga is beneficial for this population. Yoga and physical conditions. When it comes to more physical conditions, yoga has significant therapeutic benefits. Yoga can reduce cardiovascular disease severity, arthritis symptoms, hypertension, inflammation, cancer symptoms severity, and disability after a heart attack. The pose being featured here is eagle pose. An extremely exciting finding from a randomized controlled trial about cardiac rehabilitation was that the patients who were in the yoga intervention group had a faster return to pre-infarct activities. Yoga helped them get back to things they were able to do and enjoy before the heart attack disrupted their lives. Before engaging in yoga with this population, make sure to review sternal precautions, which include limiting pushing and pulling motions. The type of yoga to be done with this population would be very gentle. Also, make sure that the patient was cleared by their doctor to practice yoga. Sternal precautions often last 6 to 8 weeks. Blood pressure is an important and universal health indicator. Deepa et al. 2012 compared 17 clinical trials and concluded that yoga is clinically effective intervention to lower blood pressure. On average, yoga in general lowered diastolic blood pressure by 4.17 millimeters of mercury and systolic blood pressure by 3.26 millimeters of mercury. However, when yoga interventions were more varied and authentic, blending multiple postures, breathing techniques, and guided meditation, resulted in 8.17 millimeter of mercury decrease in systolic and 6.14 millimeter of mercury decrease in diastolic. Lower blood pressure means lower risk for cardiovascular disease and lower symptoms of anxiety. These reductions in blood pressure are very worthy of consideration since it could be the difference between being in the normal range or pre-hypertensive range, as you can see in this table from the American Heart Association. In a systematic review and meta-analysis, Sanogo et al. 2023 compared 28 studies that examine mind-body practices and type 2 diabetes severity indicators like HbA1c, which is average blood sugar in the past 2 to 3 months, and fasting blood glucose. The interventions included yoga studies, MBSR studies, and Qigong studies. All three modalities showed a statistically significant reduction in these type 2 diabetes severity indicators. The researchers found that yoga had the best evidence at reducing blood sugar levels in type 2 diabetes, and a meta-analysis regression showed that yoga had a dose-response relationship with blood sugar, meaning the more yoga the type 2 diabetic did, the more their blood sugar decreased. The general conclusion of this 2012 systematic review of 15 randomized controlled trials is that daily yoga over 2 to 3 months shows significant decreases in pro-inflammatory markers. One of the most important health benefits of yoga is that this modality reduces inflammation. Inflammation is linked to discomfort, pain, arthritis, etc. Reviewing 15 randomized controlled trials, pro-inflammatory markers such as cytokines, C-reactive protein, immune cell counts, antibodies, and markers of gene expression in humans in immune cells have been shown to reduce as an effect of regular yoga practice. Inversions, or positions where your feet are above your head, are generally assumed to be especially anti-inflammatory because one's heart gets a break from pumping blood up from the lower extremities against gravity. Migraines are commonly experienced severe headaches that limit one's ability to enjoy life and may make them take time off of work. When medical therapy was combined with yoga, the yoga group had less intense migraines and less frequent migraines. They also had favorable outcomes in pill count, the headache impact test score, and the migraine disability assessment. One yoga-based position that helps me every time I get a headache or migraine is child's pose with a block under my forehead. I put pressure into my forehead from the block and move my forehead left to right. Favorable outcomes included the headache impact score and the migraine disability assessment. Yoga and asthma. A randomized controlled trial with 112 asthma patients was conducted. Patients were given 12 sessions of yoga, which lasted between 60 and 90 minutes and included pranayama, yogic breathing exercises, asana, postures, and relaxation. Statistically significant findings included that the patients had increased scores on the asthma control tests and the asthma quality of life scale, in addition to a better general control of symptoms. Increased quality of life is a common finding across yoga studies. Yoga and colon cancer. In a study on yoga for people with colon cancer already receiving chemotherapy, the yoga group had more hemoglobin and carcinoembryonic antigen, in addition to less anxiety, depression, and even showed fewer serious symptoms. This finding suggests yoga is a great adjunct to cancer treatment for both biomarker and mental health reasons. Contraindications. Contraindications, joint precautions. Joint precautions are when movements are contraindicated due to a patient's condition or surgery. This is the most important contraindication to screen a patient for prior to initiating yoga practice. Some examples of joint precautions are that after a total hip replacement, you cannot bend the hips past 90 degrees. Internally rotate the hips or adduct the hips, making many positions in yoga not safe for the patient. Yoga is not always safe. Sternal precautions often put in place after open heart surgery, including not lifting the arms above the head, shoulder flexion, or even to the side, shoulder abduction. Also, putting arms behind one's back is contraindicated when sternal precautions are put in place. If you remember this chart from the other lecture, when it comes to styles of yoga, more gentle styles like restorative yin, gentle, and kripalu yoga have less contraindications. More vigorous lineages / styles of yoga like Iyengar yoga, Bikram, Vinyasa, Ashtanga, and power yoga have more contraindications and are considered less safe. Keep this in mind when recommending different styles of yoga to patients. The most important contraindication to be aware of is that neck hyperextension can cut off circulation in the basilar arteries, which could increase the risk of stroke, especially for older adults. I have an advanced practice, so I have posed for pictures with my neck in hyperextension. Most yoga instructors, sadly, do not know this, and this would be the move, bringing the chin away from the chest dramatically, that I would recommend against and never do with a patient. I included a news headline of an Instagram yoga guru who suffered a cerebrovascular accident and a picture of myself in the contraindicated position. Carotid and basilar could cause a tear or rupture or could kink, causing a clot to form in the arteries that supply blood to your brain. When I teach Kapalabhati, I liken it to one of those whoopee cushions that reinflates on its own passively after someone sits on it. It's a forceful exhale through the diaphragm and passive inhale. It has a lot of health benefits, but also has a lot of contraindications. It is always performed at the end of a Bikram yoga class and often performed during a Kundalini yoga class. This sort of breathing has all sorts of contraindications. Epileptics should not do it as it could induce a seizure, the fast, rapid breathing. Yoga and Medicare. It is my personal opinion that the US healthcare system is broken, convoluted, and simply annoying to navigate as either a patient or a clinician. However, I have a lot of hope in complementary holistic interventions being built through our health insurance systems. The CMS, Centers for Medicare and Medicaid Services, officially does not consider complementary alternative medicine holistic modalities to be a standardized medical practice. However, they will reimburse for a yoga class for cardiac patients offered at a hospital as part of an intensive cardiac rehab program. Clients can therefore get yoga through OT, PT, and intensive cardiac rehabilitation. Insurance billing for yoga. As an occupational therapist, I have billed yoga-based movements as therapeutic exercises, a code that is available to physical therapists and occupational therapists in their documentation for services. Many clinically indicated therapeutic exercises on a home exercise program software database come directly from the yoga tradition, such as cat-cow movements and gentle active range of motion exercises that often preclude deep stretches in a yoga class, such as shoulder circles and wrist circles. In mental health settings, several disciplines can run yoga-themed therapeutic groups, which include RNs, OTs, psychological counselors, and recreation therapists. I have also billed yoga as therapeutic activity, which is a code available to occupational and physical therapists when the intervention given is more activity-based than straight-up exercises being done with the client. I have done yoga as a therapeutic activity with many clients and would bill it as synchronized movement sequence to improve muscle synergistic controlled movements. This is within my scope of practice because yoga was an occupation that the client was wanting to get back to. Additionally, Medicare Advantage plans, which is different from standard Medicare coverage, often have benefits which include discounts on gym memberships, which could offer yoga classes. These are also often applicable to yoga studio memberships. Supplemental plans like AARP to Medicare plans also often have a fitness reimbursement, which can include yoga. Yoga and Medicaid. Despite a growing clinical evidence base for yoga as helpful, Medicaid still considers it a complementary alternative medicinal modality and is unlikely to cover it directly. However, therapeutic yoga groups are frequently found under other Medicaid-covered entities, such as in-hospital settings, behavioral health settings, which can be both inpatient or intensive outpatient programs, and skilled nursing facilities. One-to-one yoga instruction covered by Medicaid is most common through prescribed occupational and physical therapy practitioners who are assigned to work one-to-one with a client. In short, Medicaid does not cover yoga directly, but does provide access to yoga indirectly. The pose being featured here is locust pose. Common yoga research limitations and future directions. If you recall from the other lecture when we went over the 8 limbs of yoga, yoga is a heterogeneous set of movements, static postures, breathing exercises, ethical values, and meditation. This makes for a lot of difficulties when it comes to comparing and evaluating research studies on yoga. Reliability is difficult as the methods used and relationship to the teacher in one study are likely very different from those of another study. Also, when systematic reviews and meta-analyses are done to evaluate and compare multiple studies, it is very difficult to run the data since the interventions described and methods used are very different in different studies. The yoga poses featured are lotus position and wheel pose. Further limitations in yoga research include that the yoga intervention is often poorly described in the studies, making it difficult to really know what yogic movements are good for what conditions. Additionally, yoga takes time and energy, especially when compared to taking a pill. This makes for small sample sizes and high dropout rates within yoga studies. Future directions. Yoga continues to grow in popularity. Yoga's not going anywhere. There is so much research being published about yoga that increases in quality and quantity each year. Yoga, interestingly, right now finds itself at the intersection of fitness and healthcare. It is becoming more medicalized, and its integration into patient care will increase the quality of life of patients in a cost-effective, meaningful way. Yoga is so adaptable as group or individual treatment and can be done in one's bed, in a chair, or on a yoga mat. Healthcare professionals can use yoga with clients, serving as a bridge between holistic ancient practice and modern evidence-based patient care. Ancient holistic knowledge can be used to exponentially increase the quality of life of our patients, and we have actual data to back that up. The pose being featured here is straddle pose against the wall. Namaste. Yoga is an effective adjunct treatment for musculoskeletal, psychological, and physical conditions. Thank you guys so much for listening to my presentation. I believe yoga could help you, your clients, or your colleagues, and hope this information was useful in increasing your understanding of the evidence base for yoga to be used as a clinical intervention. Yoga is an efficacious wellness modality. The more yoga one does, the more health benefits they will receive, as indicated by the well-cited dose-response relationship between yoga and health benefits throughout the literature. I hope you enjoyed learning about some of the nuances of what it means to practice yoga and the scientific evidence base for yoga. Here is my references for information, part 1, part 2, part 3, and my references for images. You may contact me, Samuel Gentile, the lecturer, for questions, comments, feedback, opportunities for yoga-based higher education curriculum development, and yoga research. I want to give a huge thank you to the Oregon Healthcare Workforce Institute Area Health Education Center at Pacific University for believing in me to create content for their program.